Hello everyone, good evening. We are back with yet another episode of BMC Global Live Al-HILAL Health World, Nothing But Lifestyle. I am Seema Alva, your host for today. Good oral hygiene is a lifetime commitment. Bad oral health may lead to many complications. Today we will be discussing about good oral health. And the doctor joining us today is Dr. Seema Alva from Al-HILAL Hospital, Muhaarq. She is a general dentist with an experience of more than 17 years. So, doctor, welcome to the show.
Hello, Jessila. Nice to have me.
And thank you for joining us today.
Thank you, Jessila.
It's a pleasure. So, doctor, we are discussing about oral hygiene. Can you please explain about the importance of oral hygiene and how often should a person visit the dentist?
Yeah. The oral hygiene is a very important thing in everybody's life, you know. The oral hygiene, it is a channel through which our entire digestive system can be kept clean. And also oral hygiene, it indicates or signals many other systemic issues, like, you know, if you are having a gum bleeding and you are keeping the good oral hygiene, but still are having that problem, maybe it indicates that there may be other underlying systemic causes, like, you know, vitamin deficiency, or you are having elevated blood sugar. So it is important to see the dentist to find out the underlying causes.
Okay, doctor, we know that many people have the problem of bleeding in the gums while brushing. Can you explain it?
Yeah, bleeding gums, it's maybe because of the many factors. The main thing is the poor oral hygiene, and the second thing is gum diseases. Gum diseases means like when you are not keeping your oral hygiene well, when the bacteria, they colonize on the tooth surface, and we call it as calculus. When this calculus is started irritating the gum starts inflame and it started bleeding. So prevention is like proper effective oral hygiene, brushing technique, flossing and rinsing, and if the problem persists, is continuous, then you have to see the dentist.
Doctor, we have a query from the viewers about the bad breath. Many people have this problem. How to overcome this?
See, bad breath, or we call it mouth odor or halitosis, it is a common for everybody. Once you get up in the morning, because of the stagnant saliva, the bacteria are active and people are having this problem. Once you brush out or flush out in the morning, it will be fine. But halitosis, also there is many other causes for the halitosis or bad breath. The main problem is like poor oral hygiene, and people are having sinusitis or some gastritis problem, or the old or cracked fillings, restorations. All these things causes halitosis. Overcoming this problem is definitely the proper brushing technique, flossing, rinsing, drinking lots of water, and balanced diet will help. If the problem persists, then you have to see the dentist.
Okay. Doctor, now we would like to know more about the sensitivity of the teeth.
Okay. Sensitivity is mainly because of the, when there is a tooth, there is a crown and the root parts are there for the tooth. When the root portion is exposed, because of the calculus, what happens, the gum, it comes below the physiological level and exposes the junction of the root and the crown. That leads to the sensitivity. And other factors leading sensitivity is like initial tooth decays, or we call it enamel wear. When the people are drinking or eating so much of acidic food, it causes the enamel wear. That also causes sensitivity. To overcome this problem is definitely avoiding the triggering factors. Then if this persists, then you have to see the dentist. They may prescribe you for some medicated desensitizing toothpaste.
And doctor, now we would like to know about the whitening of teeth. That's a usual procedure now. Is it safe?
Yeah, whitening of the tooth is safe if you do it properly with the recommended dentist product at home or with the dentist on a child side. But more frequent using of any product without a dentist recommendation, it is not safe. It gives the sensitivity or it leads to the problems.
And doctor, if I have the crown or thing,
that is also, that is true. See, when you are having a crown or a bridges or fillings, that the whitening product will not work on that. It work only on the natural teeth, the enamel layer. So in this case, how dentists can help you is like they will do the whitening process. Once you get the desired color or desired shade, they will change the restoration or a crown or a bridges to uniform your smile.
Now doctor, about the tooth decay. How does it happen? What are the causes and what are the treatment options?
Yeah, Tooth decay is like when everybody having a normal bacteria flora in the mouth, when this bacteria come in contact with the food what we eat, they break into sugar and acids. What the acid releases, that acid it eat up the enamel and it gives a caries.
So doctor, now we would like to know about the dental cavities or caries, and how does it occur, and also what are the treatment options?
Yeah, so dental cavities are mainly caused by the, everyone has a bacteria in a normal bacteria flora in the mouth. When these bacteria are come in contact with the food, they break into sugar and acids. What the acid releases, it eaten up the enamel of the tooth and it gives a cavities. So prevention is definitely like you have to maintain the proper oral hygiene and regular checkup with the dentist. Initial time the dentist, it will help you with the restorations. If the cavities it reaches very deep, then it gives a sensitivity, or when started the pain, then definitely you have to go for the root canal. And then if the tooth structure is grossly destroyed, then you have to fix it with the crown also. This is the treatment options. Yeah.
Okay, doctor, many of us face dental pain. What are the main causes of dental pain?
See, dental pain main cause is definitely tooth decay, and when it reaches very deep and reaches the inner layer of the tooth, nerve, or you call it pulp layer, it started giving the pain. And even gum infections, it gives pain. And sometimes the cracked tooth, fractured tooth, some people are having even night grinding or a bruxism, that gives the chips off or a cracking of the teeth, but people may not notice, but all these things leads to the pain.
Can you suggest some home remedies to overcome this dental pain at home?
Home remedies for the dental pain is definitely is a temporary. So on counter you can take a painkillers, or sometime the people are having pain with the cold. Some triggering factors would be cold. That time you have to avoid the cold food, or sometime if the necrotic tooth we call, the pain will comes with the warm water. That time you have to avoid the hot water. But definitely for the permanent solution, you have to see the dentist.
Now, doctor, what is your message for our viewers regarding good oral hygiene?
Yeah, message for the dentist: see, the tooth structure of the tooth is such part of body. Is everybody knows, like once it is damaged or it is injured, it can't heal by itself, unlike other body parts. So it heals certain extent. So it is always better to see the dentist. And second thing is, the people having the misconception that once you do the filling or any treatment in a one particular teeth, they think that there won't be any future problem in that. But it's not true. Once we do the filling, maybe there is chances of the secondary caries or underlying caries. In the initial stage, people will not find out, but dentists can help you in this. So everything is, when there is an initial in the beginning, it is easy to treat. So it is always better to consult a dentist once in 6 months. It is my recommendation.
And finally, before we wind up, doctor, what do you have to say about Al-Hilal Healthcare?
Yeah, Al-Hilal Healthcare is a globally establishing health organization, and I am happy to say that I am part of it. Like what make Al-Hilal so unique is, like once the patient walks through a door, our priority is like patient safety, comfort, and the well-being. And also we are a team of skilled professionals. We work collaboratively to provide an evidence-based services, but while maintaining the empathetic and the warm environment that really makes Al-Hilal so special.
Thank you, doctor. Thank you for joining with us today and giving us a lot of valuable information. Thank you once again.
Thank you so much, Jasila. Thank you. Nice to see you.
So viewers, I hope this was a very informative episode and you got all the information about good oral hygiene. For more informative episodes, tune into BMC Global Live Al-Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jasila Mujib signing off. Good night.